والصلاة والسلام على المبعوث رحمة للعالمين وعلى آله وصحبه الأكرمين. Leptospirosis, a work-related infection. Professor Mahmoud Hani Sulaiman. Organism. Leptospira interrogans with large number of serovars. Most important of it is ectohemorrhagia. Pass in rat's urine and contaminate any area. It needs moisture, e.g. canal or sewer or damp soil, mines, washings of abattoirs or similar conditions. pH. Leptospira killed in acid environment, so it is commoner in alkaline environment. Salt water and chlorine rapidly kill organisms. The upper photo is a scanning electron micrograph of cells Leptospira interrogens showing helical structure and curved hooked ends. The lower photo shows leptospiras viewed by dark field microscopy. Occurrence and distribution. Where rats are common and favorable conditions, infection is widespread. It is common in tropics, particularly where soil is alkaline or irrigation canals is used for agriculture. So, infection is common in rice paddy areas and sugarcane estates. Association of disease with certain occupations is helpful in making diagnosis. Mine workers, farmers, canal cleaners, sewer workers, people work in cleaning and preparation of fish or in abattoir are at greater risk. These are characteristic presenting clinical syndromes of zoonosis with examples. Of course, Leptospira is one of them. They are either skin lesions, fever, diarrhea with or without fever, chest symptoms, miscellaneous with or without fever. As you see here, leptospirosis is one of them. Leptospirosis is one of them. Occurrence and distribution of leptospirosis. Flooding widen area of contamination, leading to increased disease in people normally not get this disease. Any alteration in conditions which lead to increase in rat number will lead to increase of disease. Leptospirosis is very widespread zoonotic infection endemic in many rodents, especially rats. It is found in a variety of other animals: opossums, mongooses, skunks, hedgehogs, squirrels, rabbits, and dogs. Rattus and Rattus norvegicus are most important reservoirs. Transmission. Leptospira enters human skin via minor abrasions or mucous membrane, although it is able to enter unbroken skin. Exposure to contaminated moist areas as swimming in canals, walking barefoot on damp rat-infested soil. Disease transmitted by rat bite, aerosol inhalation of contaminated fluid, or ingestion of contaminated food. This type of transmission leads to use of it as biotourism. Transmission. Animals infected with different serovars, cattle and water buffalo with hard jaw, dogs with canicola, pigs with pomana. These domestic animals subsequently excrete leptospira in their urine, contaminating surroundings. Incubation periods around 10 days. Period of communicability. Leptospira are excreted in urine for several months, but person-to-person spread is rare. Clinical features. The majority not symptomatic at all. However, many people only have mild infections in endemic areas. Children are most commonly infected. Begins with fever, malaise, vomiting, myalgia, then jaundice subsequently develops. Maybe hemorrhages into skin, mucous membranes, and internal organs. May lead to a more serious form with liver failure, renal failure, or meningitis. This picture shows leptospirosis rash in an adolescent boy that shows generalized vasculitis caused by this infection. This photo shows jaundice, hemorrhage, and conjunctival suffusion in acute leptospirosis. These two pictures shows severe pulmonary hemorrhage in leptospirosis. The left one shows chest X-ray. Right one shows gross appearance of right lower lobe of lung at autopsy. This patient, 15-year-old in Peruvian Amazonian city, died several days after presentation with acute illness, jaundice, hemoptysis. Blood culture yielded leptospira interrogans serovar. Diagnosis: finding motile organism by dark field illumination in wet blood film during first week of disease. After this time, serology or animal inoculation used. Leptospira may be found in urine from third week onwards. Culture of organism can take up to 1 month. Serologic tests are helpful when positive, but may have poor sensitivity during first week of illness. PCR of serum and urine may be used. Culture can be done using blood early in course and urine later, but requires special media. To help the physician, this diagnosis score was put. The most important part is the lab. Positive IgM by ELISA, take 15 points. Microscopic agglutination, 15 points. Microscopic agglutination test, rise increasing, take 25 points. Then come the group of risk factors for exposure: heavy rainfall, flooding, animal contact. Then come the clinical signs and symptoms: proteinuria, jaundice, meningeal signs, myalgia, conjunctival suffusion, and fever more than 39 degrees centigrade. Therapy of leptospirosis: antibiotic Secummectin, initiated as early in course of disease as suspicion allows. For mild disease, doxycycline, amoxicillin, or oral ampicillin. More severe disease, IV ceftriaxone, ampicillin, or penicillin. Patients with early renal disease with high output renal dysfunction and hypokalemia should receive aggressive volume repletion and potassium supplementation. Patients who progress to oliguria, renal failure, should undergo rapid initiation of hemodialysis or peritoneal dialysis, which is typically required on only a short-term basis. These are the antimicrobial agents recommended for treatment and chemoprophylaxis for leptospirosis. For treatment, this, read it and use it. For chemoprophylaxis, doxycycline, which is 200 milligram orally once per week. It is very unique. Once per week. Please print this and use it. Prevention and control of leptospirosis. Avoid areas contaminated with rat and animal urine. Very easy. Various measures are decrease rats by extermination and protection of buildings, especially those used for preparing meat, fish, and housing of domestic animals. Rat control in coming slide. Burning of sugarcane fields after harvest, drying rice fields. Wearing PPDs, personal protective devices or personal protective equipments, to decrease abrasions and contamination. Avoiding canals, lakes, water known to be infected. Decrease number of dogs. Providing proper pens with drainage for domestic animals. Urine does not collect. This will lead to surroundings not contaminated. Wash down food premises with a solution of chlorine. This slide shows rat control. Please print and use it. Rat control. Rat control. Please print it and use it. Vaccination of agriculture and companion animals is practiced, and vaccines for humans used in these countries only. France, Cuba, parts of Asia. France, Cuba, parts of Asia, there is vaccination for this disease. Doxycycline prophylaxis, we mentioned it, can be used where short-term exposure is expected, e.g. in troops going to tropical areas. Treatment, as we said before, benzyl penicillin 2 million international urine or doxycycline mid 100 mg for 7 days. Better within the first week of illness. Surveillance. Leptospirosis is a notifiable disease in many developed countries. If outbreaks occur, investigate source and specific control measures. These are some key features of the disease. I put it at the end to summarize the subjects for you. It is one of the emerging zoonoses. We will give a lecture at the end about what is emerging diseases, emerging zoonoses that cause substantial morbidity and mortality. Weil's disease, name given to classic severe leptospirosis. Weil's disease, classic severe leptospirosis, characterized by jaundice, renal failure, and high mortality rate. Leptospirosis is associated with pulmonary hemorrhage syndrome, recently recognized severe disease causing massive bleeding into lungs and poor clinical outcome. Pathogenesis still unexplained. Diagnostic confirmation rarely available. Individuals with leptospirosis should receive antimicrobial therapy, doxycycline, for example, penicillin. No commercially available vaccine for use except in these countries we mentioned. to prevent leptospirosis, although prophylactic weekly doxycycline can be used. It is a very unique dose. At the end, I say, Alhamdulillah Rabbil Alameen, thank you for your good listening.